summarize the Ivotion system portfolio, let's take a look at the materials, the instruments, hardware, software, and the tooth libraries. I want to start by saying the instruments and hardware, you do not have to change what you are doing. This is just an additional aspect in the portfolio if you decide to go this route down the road. It just adds on an additional layer of specification and accuracy to the system, but you don't have to do it, okay? The whole point of showing the Ivotion product is you don't have to do anything different and still benefit from this wonderful product. But this is just there if you decide to go that route down the road. The materials, the Ivotion, Ivotion Dent, Ivotion Dent Multi, the Ivotion Base, and the Ivotion Bond Kit, including the ProArt CAD Try-In, is all incorporated in this wonderful system. The tube libraries, your Fornares, your Orthotype, your Blue Line, is all incorporated into this system. So you won't lose anything that you're used to as far as aesthetics, what you need for your patients. Let's compare Ivotion versus print and analog. So when we compare analog, injection, print, and Ivotion, let's take a deeper look. As far as the predictability, the Ivotion comes out on top. Primarily the aesthetics, even though the print does look good, the strength is non-comparable. Super strong. There's zero shrinkage. So the fit is superior, even though the print also has great fit as well. Even the injection has a fantastic fit as well, but it still has shrinkage in the injection. The analog is all over the place. It's very variable. Looking at how easily we can reproduce these four techniques, of course, the analog and injection, a lot of variables. Whereas the print and the Ivotion has good accessibility. With the Ivotion, contact row. Getting to the cost effectiveness. For all of these, there is no startup cost. But I definitely want to stress the fact that this is how this has transformed my practice, okay, is the minimum chairside post-op visits. I can't stress it enough. This is what, to me, makes it so exciting, is because later on in the webinar, I'm going to go over how this will impact your practice, but this is an extreme importance, and it's amazing what it's going to do for your practice. And lastly, the future-proof, the first two, they're not, because you have to restart all over the records for your analog and your injection techniques, whereas the print and Ivotion, you are going to have digital records, but everything that is highlighted in yellow is what makes the Ivotion stand out. Aesthetics, strength, zero shrinkage, get great fit, long lasting, stain and microflora resistant. Since we are dentists, we are definitely striving to improve the oral health or hygiene of our patients. I think that's a big plus also. Has a seamless workflow. You can contact Row to get access to the Ivotion. Here's a big one here, the minimum chairside post-op visits, which we're going to hit home later on in the webinar. And there is a digital storage of records for the prosthesis, So it's future proof. So why Ivotion? Because it fits all 5 criteria. And then being predictable, you're going to get great aesthetics, guys. You're going to have the strength. You're going to have the fit. It's going to last a long time. It's the most hygienic prosthetic you can put in someone's mouth. That's a polymethyl material. As far as the workflow, it's seamless. When you send in your records and your prescription to Road, it's going to be seamless. Everything is going to fit in that software so that your patient gets the best result. Easy accessible. Road Lab has a good reputation. Ivoclar has a great reputation with their products. Cost effectiveness, I can't stress this enough. This post-op visits, when you see it go away in your practice, you're going to be smiling ear to ear. Not only because it's helping you grow, but you know that your patients are taken care of. And lastly, future-proof digital storage. You can't beat that. There's nothing like. This also goes with the post-op visits in that if they do lose something or it breaks, that's also saving you time. Because now you don't have to do anything. You just call up Rose and, hey, I need another one. What better way to service your patients? This is a fantastic product. So in this diagram here, it's showing the indications for Ivotion. Everything from complete dentures, the immediate dentures. You even have your overdenture, your tissue implant supported dentures. You have your all-on-edge cases that are fixed. You even have your partial dentures and your single dentures. Let's go through and see what this looks like in practicality in real life. If you have a patient that is consistently breaking their dentures, Ivotion is definitely a fantastic indication. Here we have a patient that was wearing, to the left here, a conventional denture where he was constantly breaking it. To the right, it is showing the Ivotion upper and lower dentures. The aesthetics are fantastic. In this slide, we see the overdenture, the tissue implant supported prosthetic for the lower, and it has a conventional Ivotion denture in the maxilla. As you see, this is the oversized milling process that I did myself in my lab because his unique anatomy would not fit on the one-piece puck. This denture is nearly 4 years old with 0 problems. This case here is showing a patient who will be transitioning out of this partial probably to a full denture, either an overdenture, but for now he's in a partial. He did not want to have any clasp. Once again, this denture has been in service for almost 3 years with no problems. I love this case here. This is a tremendous transformation for this patient. As you can see, this is going to be an immediate denture case. So the first 2 slides, actually the first 3 slides, I'm sorry, are the day of the surgery. This last slide here is 1.5 years later. Fantastic. Minimum post-op visits, that you normally would expect from an immediate denture patient. But this is a one-piece Ivotion that you're seeing right here. Another immediate denture case as a single arch. This patient here has a unique history in the fact that she was dealing with a lot of emotional issues. She was wearing this partial denture that was in 3 pieces that she was gluing together. This is showing that I did conventional impressions, a wax up. This was scanned in my lab. I sent this out for design, which they followed my wax up. And beautiful. This is a one-piece, immediate, single arch Ivotion denture delivered that day. We have another scenario where we have an immediate implant over denture. Not only are we replacing the lower, we're also replacing this upper denture. The extractions we completed, the dentures already made that day, but it was a wash impression pickup technique, finished down in the lab, and delivered back to the patient. Once again, a upper and lower Ivotion denture. I love this case. And this just is going to show you just how realistic this product is. And so with this patient, he has a all-on-X zirconia implant-supported prosthetic for the mandible. In his maxilla, it is a conventional Ivotion denture. The shade match between the two materials is so similar, it's incredible. This gives you another perspective in how you can help your patients in meeting the aesthetics and the strength that they desire and demand nowadays. This is a beautiful case. So if you were wondering just how good does this product look compared to zirconia, well, there's your answer. Some other fantastic indications for Ivotion is if you are into doing same-day teeth or want to get involved with that, this is the perfect material. One of the things when you're doing same-day teeth, is it going to break? How soon is it going to break? Is it going to look very aesthetic? How are you going to make that particular prosthetic match what you place with the implants? Rowe has a fantastic system. You can call it, ask them about it. It's a chrome lock system. This picture here is showing the pickup. Okay. This picture here is showing how we're eluting this pickup so that we can make the fix temporary. We also have an indication for same-day teeth. It is the perfect long-term provisional in this situation. Not only is it strong, but it's extremely hygienic. And this is one of the predictability that we were talking about earlier, is when you have patients that are wearing this, long-term provisionals, there's no metal substructure in this. You need to be strong, you need to be aesthetic, and it is a tremendous plus that it's hygienic because it's going to make sure that everything stays in a healthy state in the mouth. Fantastic. This case is going on 10 months now.